My name is Wendy. I'm 62 years old, and I was diagnosed with stage 4 breast cancer that had metastasized to my liver and hip bone about a year and 4 months ago. Well, that was a little bit of a surprise when I got the scan because I had been getting regular ultrasounds every 6 months because I had a history of breast cancer in my family. I lost my mom and her two sisters to breast cancer and lymphoma. And so I was very wary about it. I had been on top of it. I'd been working with a naturopathic doctor and watching it very carefully. So I was rather shocked when he said he wanted me to see an oncologist because he was nervous about my cancer marker going up. And we didn't know exactly what that meant because all my ultrasounds were coming back benign. But I was thankful that he also found Dr. Von Schaefer for me and really had a high opinion of her from what he had read about her. So I was eager to meet her, but I wasn't expecting her to say that I had been misdiagnosed most likely and that I needed to get a PET scan, which I did later that month and found that I indeed had stage 4. When we found out that this was a real diagnosis, my husband and I were devastated and couldn't even talk to each other about it for about a day. And then I had to make my peace with it and decide what I wanted to do. And I had always done the kind of medicine that was more along the natural level. And so going to an oncologist and considering having chemotherapy and that kind of thing was scary to me and not something I ever thought I would do. And in fact, I had told my husband I would never do chemotherapy. So you know that my trust had to be very high in Dr. Von Schaefer to take her recommendation and go ahead and enter that realm and do that kind of treatment, partly because my diagnosis was so severe, but partly because I had a real deep trust in her. On the day that we met to discuss treatment after we got the results from my PET scan, my husband asked her about stage 4 and what that meant. And he said, "That sounds really severe." And she said, "Well, it depends on your perspective." And I loved that she said that. She said that, yes, stage 4 in any other situation sounds very daunting because most other doctors don't know what to do with stage 4. But she assured us that she did, and that brought me great comfort. And it was the reason I went forward with treatment and did what she asked me to do because I trusted her. And I think that's really important when you're looking for a doctor, that you have that resonance with them, that they know what they're doing and they are confident in your treatment plan and that you are confident in them as well. And that's why we ended up choosing Dr. Von Schaefer. Well, first of all, the day after we found out the diagnosis, I just sort of sat in quietness and listened to my inner voice. And I prayed and I asked for guidance. And I really felt that Dr. Von Schaefer cared about us. And that was obvious because we were rattled when we got the diagnosis or when she told us that, yes, indeed, I did have cancer. Uh, we we had to be shuffled off to another room just to take it in. And she was so respectful of the emotion that we had. And that said a lot to me because I wanted a doctor that cared. And I'd been to many who didn't. And that wasn't a route I wanted to take at all. And so when I saw the depth of her care, I saw the depth of her knowledge. She's obviously brilliant. And you can guess that in a millisecond after talking to her. And then the combo of the two was so compelling to me and to my husband that we decided we were going to trust her. And because she said she knew what she was doing and that this was something she knew how to handle, that registered with us and resonated with us as true. And so I just decided that even though I had said I would never do chemo, and that's what she was recommending for us, I liked that it was low dose. I liked that it wasn't a full uh, brunt on my body, because the other factor for me is that I've been a type 1 diabetic for 50 years. And so I already had that going on. And I also wanted a doctor that cared about that and that wasn't going to just push through a treatment plan because that's what she always did with everybody else, that she would know that I have particular sensitivities. And indeed, she did. And I noticed that other people were coming more often for treatment, and she was giving me rest days in between and making sure I could recover. And I didn't even have to ask her for that. She knew. She intuitively and just from her wisdom as a doctor knew that that's what I needed. And so that also notched up my confidence in her for the way she was kind and careful. And I just don't feel like I'm saying that well at all. but um, but the way that it wasn't just the treatment plan, it was the way she shared it with us. It was the way she implemented it. It was the fact that she would stop by our treatment rooms and say good morning and give us a hug and really share from her heart as well as her head. And so I felt like we had a win-win combination. We had the best of all worlds. And that helped me relax and shift into this kind of treatment, because I thought, well, I thought I was treating something minor and I'm now treating something major. I'm going to have to rest in her experience and her wisdom. And so that's what carried us through and gave us the confidence to do something we normally wouldn't have done. Well, last year I did about close to 20 rounds of chemo, and I had radioactive seeds placed in the tumors. And that was after a couple of months of chemo. And then I had to stop actually after a little while because I was having some heart issues that we addressed. And then I got COVID and I missed about a month of treatment because of COVID. But when I came back, we did another PET scan, and although things were close to being ready, there was still a new lesion in my liver, which had been really the worst hit of all of these areas. Well, my breast and liver, but I think I started with close to 20 lesions. So those 20 or those 19 or 20 were gone, but I had a new one, and then it was tiny, and then I had a new one on my abdomen. And so it was determined that I would do a couple more rounds of chemo, the seeding, and then a couple more rounds after that. And I talked to the radiologist and I said to him, well, it sounds like the bulk of the work has been done and we're just sweeping up the crumbs that are left. And he said, that's exactly right. So those crumbs got swept up, and a few months later now, as of last week, I just had another PET scan and I am cancer free. And I couldn't be happier. I couldn't be more stunned, really, that in this short period of time, I'd gone from such a bleak diagnosis to feeling well. Um, I don't have any hair, but that'll come back. Uh, and I'd rather not have cancer, even if I have to have no hair. As long as it's combined with no cancer, I'm happy. And so our family and friends and everybody who's been praying for me have been just thrilled beyond measure, as you can imagine. And the good news is that even if statistics bear out and this comes back, I know what to do. And I know who I want to do that with. And that is definitely Dr. Von Schaefer and Dr. Doggett, because they've been my heroes throughout this and have been so kind in the process. So I wouldn't go anywhere else. And I have talked to so many people who are dealing with this, and at my age I'm finding that a lot of people are being diagnosed with cancer, and I always recommend that they at least do a consultation with Dr. Von Schaefer. They don't have anything to lose, and they could gain a lot of perspective and know if this is a right fit for them, because I have sadly watched a lot of friends do more traditional treatment and the full dose chemo, and they have not fared very well, and their cancer, even though they've maybe been told they were cancer free, in a few months it's usually back, and it's back with a vengeance and back full force. And that's just not a road I want to walk. And now I know that I'm supposed to treat cancer like an autoimmune disease that will flare from time to time and may come back, but that we just know how to treat it if and when it does. And so that gives me a lot more peace, knowing sort of what's ahead of me on my path. And of course, nobody wants for things to come back like this, but knowing that it's not the end of the world if it does is very comforting. Well, dealing with the fear that you might feel with a diagnosis like this, I think is a very personal journey. And for me, it ties in with my faith. And I know not everyone believes the same things or has um, the same, oh, I don't know what I want to call it. But for me, I really had to embrace reality. And that's something I think that Dr. Von Schaefer is really good at, is telling the truth. And I remember from our very first appointment, she said that she would always talk to us straight and she would always tell us the whole truth. And that other doctors tend to dance around that maybe and think that that's helpful, but she doesn't. And I was so thankful to hear that, because you can't adjust to a tough reality unless you know what it is. And so having the straight truth given to me, and then also having someone who was confident in what to do, it built my confidence and it gave me peace and it allowed me to rest in her, because I knew I didn't know at all what to do and she did. And so I did things that I normally wouldn't have done, and friends have remarked that that is the case, and they were surprised that I went this route. But I told them, you'd have to know that I don't know what I'm doing, and I was so convinced that Dr. Von Schaefer did, that it was sort of a no-brainer to trust her and not myself. And then the results spoke for themselves, because very quickly my PET scans improved. They weren't perfect yet, but because we had more treatment to do, but right from the get-go there was huge improvement, and that was encouraging to me. And so I knew we were on the right path. I knew I just needed to stick with it. And so I think that helped me stay on course, and it helped me that uh, we were doing periodic scans to know where we were. And um, so the way this all was structured helped me a lot to rest in treatment and rest in hope. And I think without hope, people don't go very far. And I've certainly seen people give up hope and go downhill. And so that has always been really important to me, to keep that goal and that vision in mind of what it would be like to be well. And now I'm living that life, and I'm so very grateful.